China's Hong Kong. When the COVID-19 pandemic hit, the Hong Kong nursing home where Amy's 78-year-old mother lived battened down the hatches. Residents above the age of 65 were restricted to their rooms. Families were not permitted to come. Staff at the private clinic camped out in the office for weeks to prevent bringing the illness in from outside as the Chinese territory faced its largest outbreak of coronavirus cases. Regardless, the unavoidable occurred. Amy's mother was one of the people admitted to a public hospital's emergency room in February after suffering a fever. This senior home has some of the tightest standards in the industry, Amy told Al Jazeera, requesting only to be addressed by her first name. If 80% of its inhabitants are sick, no other nursing facility in Hong Kong can stay unaffected. With tens of thousands of coronavirus cases reported every day, Hong Kong's enormous population of unvaccinated senior residents has resulted in the pandemic's highest official death rate per capita of any jurisdiction. Despite vaccines being freely available for more than a year, only about 30% of Hong Kong people over the age of 80 have been twice immunized, owing to widespread vaccine apprehension among the elderly. In the city's sixth wave of COVID-19 deaths, 87% of those who died were 60 or older, and roughly 90% were not properly vaccinated. Many of the deaths happened in the city's elderly care facilities, which have reported infections in 87% of them, affecting 16,200 residents and 4,470 employees. Despite Hong Kong's best efforts to keep COVID-19 at bay for the most of the epidemic, the highly transmissible Omicron strain eventually slipped past the city's defenses, which included some of the world's strictest border controls. The resulting outbreak of illnesses has overburdened the public healthcare system, pushing isolation rooms, intensive care units, and morgues to capacity. Patients are routinely turned away from hospitals, and high-risk elderly admissions are sometimes left outside in the cold. Amy would have to wait 2 days to learn that her mother had been admitted to an observation ward, by which time she had developed hypothermia. Despite her worsening health, she was sent to a temporary hospital on the outlying island of Lantau, which is designed for patients who no longer require intensive care. Amy couldn't keep track of her mother's condition there, save through phone calls from doctors who gave one piece of awful news after another. Her phone never made it to her mother's hands. Amy added messages to the nappies in her delivery in desperation to tell her mother that she is not alone. There are many elders like her who require assistance with every meal and diaper change. Taking care of someone else necessitates a large network of support. Building isolation facilities will not fix the problem, Amy explained.